We welcome you back to our program, and again today we have the pleasure of having Dr. Gerayli and Dr. Martin on talking about pain, and not a pleasant subject, but something you folks deal with your patients here in our area and around the area. Today a different type of pain, nerve pain. Now we talk about the spine and different things you've done to treat the spine. Talk about nerve pain, and maybe you could define it for us, Dr. Gerayli.
Thank you, Rob. Yes, we have talked about spinal pain quite a bit on the show, and nerve pain is also very common, but oftentimes undertreated or misdiagnosed. We see quite a bit of nerve pain as a result of a variety of conditions and injuries, and it is related to any kind of an injury that occurs when the nerve becomes irritated, inflamed, or somehow damaged. And as a result, patients experience oftentimes severe pain in the distribution of that nerve.
And that could be lots of different places in your body then, apparently.
Anywhere that you have nerve endings, which is basically the
pretty much
entire
everywhere.
body, you can have it.
Dr. Martin, are there different types or different medical terms you use for this type of pain?
There are. We tend to categorize, neuropathic pain based on the etiology, which is based on the disease process. In fact, the largest part of nerve pain is really idiopathic. We don't really have a diagnosis or an underlying condition for that, but certainly some of the larger reasons for neuropathic pain, especially in the elderly, would be bout of shingles causing something called post-herpetic neuralgia, diabetes causing rather bad peripheral neuropathy. People that have had chemotherapy or radiation therapy can develop a neuropathy secondary to that. And then not necessarily a neuropathy, but certainly irritation of the nerve would be people that have a bad back or a bad neck, and compression of the nerves as they exit the spine can cause neuropathic pain either down an extremity such as an arm or down a leg.
We're back to the spine again, the area that you folks specialize in over there. It's interesting, Dr. Gerayli. I know if anybody's ever been in an ER, one of the things they ask you is, in fact, sometimes they'll even have a chart on the wall that says, how do you rate your pain? 10 being the worst pain you've ever had and 1 being not at all. And they ask you to give them a number. I think from a medical standpoint, you probably have a better way of defining the characteristics of these types of pain.
Yes, you're right. They actually have pain categorized as one of the other vital signs in the hospital. So the nurses ask almost every patient, what is your pain level?
Right.
As far as nerve pain is concerned, as Dr. Martin mentioned, you have a variety of causes. Pain from the nerves can also be traumatic. Patients who have injuries to the nerves for various reasons can have pain. The characteristics of nerve pain, however, are rather similar, regardless of what has caused the underlying nerve injury. The basic complaint that most patients have when they have nerve pain is a burning sensation in the distribution of that pain. Now, whether the pain was caused by diabetes, shingles, or trauma to the nerve, along the path of that nerve, patients experience what we call dysesthesias or hypersensitivity, a burning sensation, a searing, hot sensation. Oftentimes, light touch to the area is very painful. You don't necessarily see changes in the skin. However, when conditions like reflex sympathetic dystrophy occur, you can see swelling, redness, changes of temperature, and things of that nature. So we can clinically look at a patient based on their complaints and the symptoms that they experience, determine if this could potentially be neuropathic pain.
It's interesting, the Olympics are getting underway this week, the Winter Olympics, and we've already had some folks take some bad falls in practice and getting ready for this competition. And while there's no broken bones and maybe there's muscle soreness, potential for nerve damage and something like that as well. If you slam into a gate or one of those fences on a ski run, nothing's broken, a little bit of sore muscles, and then maybe later the nerve damage could show up as well.
Absolutely. As a matter of fact, nerve damage really doesn't show up immediately. The nerve actually takes about 7 to 10 days to actually die off or to become impaired. And at that point in time, patients start to feel this numbing, this tingling, this irritation. And that's part of how we diagnose neuropathic pain. First and foremost, it's a really comprehensive physical examination and a history from the patient. And patients will usually tell you what's wrong. They'll say, well, I was sitting on a plane for 4 hours from here to Boston, And when I got up, my whole leg was numb and it hurt and it was tingly. And once we've done a comprehensive assessment of the patient, a physical examination, and we feel like we've isolated the cause of that neuropathy, there are objective tests to measure whether in fact the nerve is damaged, to what degree it's damaged, and actually give patients an idea about how well they're going to recover. That's an electrodiagnostic test, something called an EMG. And we certainly have very competent physiatrists, neurologists, and even some primary doctors that do those tests in the area.
Right. Dr. Gerayli, I guess the bottom line is, okay, you've done the testing, you've determined, yes, there is nerve damage. Treatment modalities, how do you treat nerve damage?
Nerves try to heal from any kind of an injury. So during that time when the nerve is trying to heal, we try to create an environment for the nerve so that it can heal properly. Now, this could be the use of anti-inflammatories, could be the use of certain neuropathic medications to reduce the irritability of the nerve. Basically, the less irritated the nerve is, the better the recovery process and the faster the recovery process is going to be. Now, unfortunately, the older the patient is, the longer the recovery time is going to be. We have a long list of very good medications. Some of them are actually very new, that are very effective in reducing the symptoms associated with nerve pain. Now, if medications, the first class of medications fail, pain medications that are specifically used, again, for treating nerve pain are available. If that fails, other treatment modalities, something like spinal cord stimulation or peripheral field stimulation that we've talked about on the show before.
Previous discussions, yeah.
Can also be very effective in masking the pain so that the patient does not perceive the pain while the healing process is going on.
Well, it sounds like, especially with those of us over a certain age, the sooner we get in for treatment, the better results we're going to have, getting that diagnosed, getting that tested, and then getting the treatment started, because like you say, the older we are, the longer it takes for those things to heal. And I guess it's possible, if it's untreated, that could be a lifelong discomfort.
You're very correct there. Time is nerve and time is muscle, because all the muscles in the body are supplied by nerves. If you in fact wait to treat a neuropathic injury, you can actually suffer atrophy of the muscle and potentially loss of that muscle strength for the rest of your life.
Yeah.
So it is, as you say, very important to treat those things timely.
Yeah, and like we said, a lot of times the first injury is the sore muscle, or even maybe a broken bone, which is dealt with. But then that nerve damage, like you said, can take place days later.
Agreed.
We're not really aware of it till later on. Gentlemen, we thank you both for joining us, and again, some good information there. That may be a kind of pain that's troubling you. If you'd like more information, you can give their office a call and find out more about how they can assist you and help you get over what's ailing you, as they say. 855-7560. Thank you both for joining us. Good to have you on the program
Appreciate
today.
your time.
Thank you.
We'll be coming right back with more good information for you as our program for this day continues right here on Channel 6.
Exciting news for people in pain. At Spinal Pain Specialists, we treat various pain syndromes. With non-surgical treatments for your back or neck pain, please contact Spinal Pain Specialists Medical Corporation. For a comprehensive evaluation, call Spinal Pain Specialists today to find the help you need. The treatment you need is now available. Please contact Spinal Pain Specialists Medical Corporation so you can begin living your life to the fullest without pain.